administration along with medication. The first thing that I am going to do before I get started is to verify the doctor's order. Once I have verified the doctor's order, I will then knock on the patient's door. I am going to introduce myself, going to close the door behind me or pull the curtain for patient privacy. I'm going to ask that the patient verify their name and date of birth. Along with having the patient verify their name and date of birth, I'm also going to take a look at their wristband to confirm. After I've confirmed the identity of the patient, I will explain the procedure, inform them what the doctor's orders are. At that time, I'm also going to ask that the patient confirm any allergies to any medications that they may have, as well as ask if the patient has any questions about the procedure. So at this time, the patient has confirmed their name and their date of birth for me, as well as any allergies. Patient has stated that they have no known allergies to amoxicillin. Also, at the time of verifying the patient's name on their wristband, I have already assessed the patient's IV site. There is no noted redness or swelling. Patient's arm is regular in temperature. There's no signs of infiltration or phlebitis. So at this time, I'm going to perform some hand hygiene. I'm going to verify the doctor's orders here and put on some gloves. So the doctor has ordered for the patient to receive some IV fluids of normal saline at 150 mLs per hour. The drop factor is 15 per the hour. The drop factor is 15. We are going to administer approximately 38 drops per minute. I'm going to now put my gloves on. And we will prepare the needed equipment. So for this, I will need a bag of normal saline. I have a bag of normal saline, and the expiration date is the medication here of normal saline is not expired. I will also prepare my primary line with confirmed drop factor of 15. On my IV line, I have my spiked end. I also have my drip chamber. The IV tubing down will show my roller clamp. I will then have my Y port along with my adapter that will go into my existing IV site on the patient. For this, I will ensure that this stays sterile, so I will not remove it until I am ready. On my bag of normal saline, I have 2 ports. One, if I needed to mix anything into it, this is where I will put my spiked end. I will remove the cap. I will use my alcohol wipe to wipe this end. I have a garbage can below to catch everything. I am going to confirm that that is clean by wiping on my hand. Once I know that my glove is dry, I also know that my port is dry. I'm going to then remove my spiked end, and I'm going to spike my bag. I've now spiked my bag, and I'm going to confirm that my roller clamp is closed for this part. I'm going to fill my chamber. Okay, so I filled my chamber. Going to untangle my line here, and I'm going to prime my line. To prime my line, I'm going to ensure that I get all the air out of my line. And by doing so, I will be dropping into my wastebasket down here. I will undo my line. I will ensure. Now that I know that my line is primed, I will close this end. For this part, I'm going to hang my bag. And I am going to count on my watch. I am going to count 38 drops per minute. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 32, 33, 34, 35, 36, 37, 38, 39. So I know that there are 38 drops. I'm going to hang this line here or connect it directly into my patient. I'm going to take my gloves off and perform hand hygiene. I'm going to come back to the computer now and I am going to verify the doctor's next order. The doctor has ordered the patient to start on amoxicillin of 250 milligrams via IV, over 100 mLs normal saline over 15 minutes. I have already converted the medication over. We will do 100 mLs per 15 drop factors within 15 minutes over a period of 100 drops per minute. Now that I have already verified the patient's 6 rights, we will go ahead and prep our next medication. So again, along with comparing on the MAR, I'm going to compare on the medication itself that I have the right medication at the right dose. I'm also going to verify the expiration date, that the solution is not expired. I am going to remove the medication and toss. I am going to hand hygiene. I'm going to put new gloves on. I am going to take the top tube off, and I am going to clean where I will spike this end. I will also just do a test wipe on my glove, and I can tell when the site is dry and clean. I'm going to locate my secondary tubing. This one as well will have the spiked end and the drip chamber. This one here is going to have the clamp and the adapter that will hook in directly to the primary bagging. I will remove the covering. and I will spike my antibiotic. I will just confirm that the medication will go in through. Verify that my clamp is closed. I will untangle my lining. I'm going to prime my tube and let that drip out. I will clamp it and close it. For this, I need to make sure that my antibiotic is hanging higher than my primary. So I will change where these are at. I'm going to confirm that these are 30 inches away, hanging below. I am going to use my alcohol pad. So with my secondary tubing, I am going to verify that my antibiotic has a drop factor of 100 drops per minute. Okay, I have verified that I have a drop factor of 100 per minute. I am going to get the end of my secondary lining and I will connect it to my Y port on my primary line. Here is where my primary line will be. I will wipe that down before inserting my secondary line. With my alcohol, I will have wiped down the port to verify that it's clean. I'm going to remove my lid and insert it. I now have my secondary hanging higher than my primary. I have this part that will now go into my patient's arm. I have assessed the patient and the patient is tolerating it well. I'm going to take my gloves off and perform hand hygiene, and I am going to document